We're now into the 12th week, if you can believe it, of the COVID-19 pandemic, and trends show that in the U.S. and Britain, the pandemic is disproportionately hitting racialized communities. In Canada, it's not clear because race-based data has not been consistently collected during the pandemic. Manitoba is the only province that has started, but there are calls, of course, for other provinces to join in. So what do we know about how this virus has affected minorities? Dr. Kwame Mackenzie is the CEO of the Wellesley Institute, as well as a professor of psychiatry at the University of Toronto, and he joins us now. Hi, Dr. Mackenzie. Good to see you. Thank you very much for making time for us.
Good to see you. Thank you for having me on, Vashi.
Can I ask you to give us your perspective on why you think this data has not been collected and what the effect of not collecting it is?
Well, as you say, Vashi, in the introduction, in the UK and the US, you're twice as likely to get COVID and twice as likely to die from COVID-19 if you're from a racialized group and if you're from a Black group. And we also know that during H1N1, during the influenza pandemic in Ontario, that you are 10 times more likely to get infected if you're from the Black population. So we know that something is likely to be happening here. What I don't understand, given that we know that this happened in H1N1, and we can see elsewhere that this is happening in COVID, I don't understand why there isn't urgency around collecting these data. There really should be.
It's interesting that you mentioned H1N1 because that was a long time ago. That was a number of years ago. And when you use that example, I immediately thought to myself, well, if we knew that then, why? I mean, we've had years to make accommodations to address that, and still we haven't.
That's right. And it's quite important that we do, especially in a pandemic like COVID-19. COVID-19, what we've done, all our plans have been driven by numbers. The number of people who are infected, the number of people who are tested, the number of people who died. That's what all our plans have been based on that. Even when we reopen our economy is based on numbers. So not having the numbers and not having the data for racialized populations and Black population, and not knowing how many people are infected and what we can possibly do about it, it is a real problem. And it means that it's more likely that we won't be able to meet the needs of racialized populations. And therefore, that means that more people are going to get infected and more people are going to die than need to.
Is it provinces that should be driving changes to the collection of data, or is it the federal government that needs to lead that effort? What's your take on that?
I think that, health is a provincial issue, but when we've got pandemics, there's been significant leadership at the federal level. So I think we need both provinces and the feds to be getting together to make sure these data are collected. As you said, Manitoba has led and said they're going to do it. There are bits of Ontario, including Toronto, that are collecting the data. There is no reason why every province cannot collect these data so that we can make sure we have the most effective response that we possibly can.
If they were to start doing it tomorrow, would it make a difference, or are we too late to have a pronounced effect?
No, I think it would really make a big difference to have these data. Now, obviously, just having the data isn't enough. We need to have the data, but we also need to have a plan for what we're going to do with the data. And we need to work with communities to make sure that when we're collecting these data, we're producing community-informed new interventions to make sure we get things right, and also to make sure that communities realise that these data are being collected for the purpose of better protecting them. So I think it's important that we get the data, and it's not too late because we do not know when there's going to be a second wave or whether there's going to be a third wave or how long this is going to go on. So if we're going to plan properly, we need the data, we need it as soon as possible, and we should start tomorrow.
You highlighted something I really wanted to ask you, which is collecting the data is one thing, reacting to it and implementing policies or taking actions that then address that data is a whole separate issue. And I'm wondering what specific kinds of policies might be pursued if the evidence here in Canada echoes what we've seen, for example, in the United States or in Britain.
Well, I'd like to, first of all, get the data. The data also, shows you where the problem is, but also helps you monitor any intervention. So you need the data. But if you see that there's a population that is at increased risk, you need to try and work out why. Is it because they're more likely to be essential workers? Is it because of historical reasons and poverty? What's going on? Is it because our interventions, our public health strategies never reach to them? Or is it because we're asking people to physical distance at a time, when they're overcrowded? And we need to try and disaggregate these different possible reasons and work with communities to work out what we need to do to help people. But we do know that if once you move resources so people get tested and they understand whether they've got COVID or not, and they can make choices and they can physical distance and they can isolate if need be, that makes a big difference. And so right. We need to work with communities, but that doesn't mean that we need to forget that the public health measures we've got at the moment are very effective.
Okay, I'll leave it there. Thank you very much for your insights this evening, Dr. Mackenzie. Appreciate it.
Thanks very much.
Dr. Kwame Mackenzie is the CEO of the Wellesley Institute. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.